1. Vitamin C. Vitamin C, or ascorbic acid, helps produce collagen and support endothelial cells, which helps blood vessels build and strengthen their protective lining. Acting as a potent antioxidant, this vitamin also helps promote cell growth, prevent cell death, and neutralize harmful free radicals, all boosting healthy vessels. Plus, vitamin C can help preserve nitric oxide, an important factor that relaxes your vessels. The ideal amount of vitamin C in cells is still debated, but low levels are linked to many diseases and conditions linked to blood vessel dysfunction. These include atherosclerosis, which is plaques build up inside the arteries, smoking-related damage, and poorly controlled diabetes. People at high risk of vitamin C deficiency include smokers, heavy drinkers, those with poor diets, especially low in fresh fruits and vegetables, and people with digestive issues that reduce nutrient absorption. If you're experiencing slow wound healing, easy bruising, twisted or corkscrew hairs, skin rashes, swollen or bleeding gums, loss of appetite, or unexplained fatigue, you might be low in vitamin C. In more severe cases, some people develop woody edema, where the skin, usually on the legs, becomes swollen and firm due to poor circulation. For people over 50, it's recommended to take 75 milligrams of vitamin C a day for women and 90 milligrams for men. Smokers need an extra 35 milligrams per day. Also, your body's vitamin C needs actually increase when you're under stress. So if you're going through a particularly stressful period, you might want to pay extra attention to your intake. If you're trying to fix a deficiency, many experts suggest aiming for 500 milligrams daily. Just keep in mind, a large 2013 review suggested that taking more than 200 milligrams a day doesn't provide extra benefits. When it comes to food sources, citrus fruits might be the first thing that comes to mind, but there are plenty of other excellent sources. Half a cup of red bell pepper packs 95 milligrams, which meets your daily recommended value. A medium orange or 3/4 cup of grapefruit has 70 milligrams, a medium kiwi fruit contains 64 milligrams, and half a cup of strawberries gives you 49 milligrams. Cooked broccoli and Brussels sprouts are another great choice, offering about 50 milligrams per half cup, or just over half of your recommended daily value. This might surprise you. Frozen vegetables can retain more vitamin C than fresh ones that have been sitting on the shelf for days. When storing vitamin C-rich foods, remember that this vitamin is sensitive to light, heat, and air. Keep your fruits and vegetables in the crisper drawer of your refrigerator, 0 to 12 degrees Celsius, and try to eat cut produce within a day or two. Vitamin C is generally safe, with low toxicity, even at high doses. However, taking too much can still backfire. Extremely high doses may actually lead to oxidative damage instead of protecting your cells. For those over 50, the recommended upper limit is 2,000 milligrams per day, except for those under medical treatment. It's best to build up gradually to avoid any digestive discomfort. If you have a history of kidney stones, talk to your doctor first, as vitamin C can interact with certain medications and may increase the risk of kidney stones in susceptible individuals. Are you enjoying our video so far? If so, please give us some hints by dropping a like, and we'll make more content like this. 2. Vitamin D3. While most people associate vitamin D with bone health, it's actually crucial for your circulation too. A 2014 study in the Journal of the American College of Cardiology looked at 554 adults and their vitamin D levels. Researchers found that people with low vitamin D had stiffer arteries and poorer blood vessel function. But here's the good news. 42 participants who raised their vitamin D levels over 6 months saw real benefits, including better blood flow, improved heart function, and lower blood pressure. Yes, this sunshine vitamin is like a master regulator that helps keep your blood pressure in check and your blood vessels healthy. It does this by helping to regulate calcium levels in your blood vessels and by reducing inflammation that can damage your arteries. Plus, vitamin D3 can also help heal injured arteries. In healthy people, taking 4,000 IU of vitamin D3 daily increases specific cells, repair cells, that support blood vessel repair. Vitamin D is made in the body through sunlight or diet, but up to 70% of some populations are deficient. Most people with vitamin D deficiency have no symptoms. However, even mild deficiency can lower calcium levels and increase certain hormones, raising the risk of osteoporosis, falls, and fractures, especially in people after 50. Severe deficiency may lead to bone pain, muscle aches, depression, fatigue, twitching, and weakness. It's not just about your arteries. Vitamin D deficiency has been linked to autoimmune diseases, cancer, high blood pressure, and possibly heart failure. Your risk increases significantly if you spend limited time outdoors, have darker skin, or live in northern latitudes. To prevent vitamin D deficiency, 20 minutes of daily sun exposure with at least 40% of skin uncovered is needed. For those over 50, note that aging skin produces less vitamin D from sunlight. Your kidney function typically decreases with age, which affects vitamin D activation. And it's easier to gain weight since vitamin D can get trapped in fat tissue. And many medications can interfere with vitamin D absorption. In fact, in a 1989 study published in The Lancet, older adults, aged 62 to 80, produced about 3 times less vitamin D3 than younger adults, aged 20 to 30, under the same simulated sunlight exposure. A later study, published in Nutrients in 2020, examined how midday sun exposure affected vitamin D levels in young, 20 to 37 years, and older, 51 to 69 years, adults. Researchers found that vitamin D3 levels went up in all age groups after 30 minutes of sun exposure, but older adults produced less of it, about 13% less per decade of life. By 70, your body produces only about half as much D3 as it did at 20. If you're under 65 and don't get much sun, consider taking 600 to 800 IU of vitamin D3 each day. If you're 65 or older, go for 800 to 1,000 IU daily to help keep your bones strong and lower the risk of fractures. A typical fix for vitamin D deficiency is 6,000 IU daily for 8 weeks, then 1,000 to 2,000 IU daily. Note that more isn't always better. Vitamin D is a fat-soluble vitamin, so excessive intake can cause toxicity, though it is rare. Acute overdose can raise calcium levels too high, which might leave you feeling confused, nauseous, extra thirsty, or needing to urinate a lot. Long-term, it could even lead to kidney problems and bone pain. So it's important to have your levels tested regularly. When it comes to food sources, vitamin D can be tricky to get from diet alone. Cod liver oil, rainbow trout, and fatty fish like salmon and mackerel are your best bets, along with mushrooms, egg yolks, and fortified foods. Here's a shopping tip. Look for wild-caught fatty fish when possible, as it typically contains higher levels of vitamin D than farmed varieties. Just be mindful that these fish may carry higher levels of contaminants and heavy metals, although a 2017 study showed that all contaminant levels in fish were below EU safety limits. Protect yourself by choosing fish, especially salmon, sourced from clean waters such as Alaska's Bristol Bay and the Pacific Northwest regions, where monitoring standards are typically stricter and contamination levels lower. When choosing fortified foods, check the label to ensure they're using D3, also known as cholecalciferol, rather than D2, as D3 is generally better absorbed. If you're taking a supplement, keep it in a cool, dry place away from direct sunlight. 3. Vitamin K2. Now let's discuss vitamin K2, a crucial nutrient that helps keep your arteries clear and flexible. While its cousin K1 is famous for blood clotting, K2 has a special talent for keeping calcium where it belongs, in your bones and out of your arteries. By directing calcium to the right places in your body, K2 prevents it from building up in your blood vessels, where it could cause problems with circulation. In fact, vitamin K2 has been shown to prevent and reverse vascular calcification, the buildup of calcium in the walls of blood vessels, in animal studies. If confirmed in humans, it could revolutionize cardiovascular disease treatment. A 2025 study also highlights the link between vitamin K2 deficiency and coronary artery disease, or CAD for short, showing that lower K2 levels are strongly associated with disease severity and risk factors. A K2 deficiency can lead to issues like fractures, arterial stiffness, and infertility. K2 deficiency is particularly concerning for older adults, though it often goes unrecognized. Warning signs can be subtle but might include easier bruising, excessive calcification in arteries, as shown in medical tests, and weakened bone. Those taking antibiotics long-term, people with digestive disorders, and those on very restrictive diets are most at risk. Certain medications, such as blood thinners, can also block vitamin K activity. Eating too many processed foods instead of the fermented ones can also lead to a deficiency. There is no established recommended dietary allowance, or RDA for short, for vitamin K in the US, as there isn't enough data to determine an exact requirement. Instead, health authorities have set adequate intakes, or AIs for short, based on what healthy populations typically consume. If you're over 50, try to get about 120 micrograms per day if you're a man and 90 if you're a woman. Vitamin K2 dosage recommendations vary by country, with Japan suggesting 150 micrograms. Studies show its effects increase with higher doses, but the optimal amount for maximum benefit without overcompensation remains unclear. People taking blood thinners like warfarin need to be especially careful with vitamin K intake and should maintain consistent levels under their doctor's guidance. Also, if you have a history of kidney disease or are taking certain antibiotics, consult your healthcare provider about K2 supplementation. Vitamin K2 comes in several forms, with MK7 being the most well-studied for cardiovascular health. It has a longer half-life in the body compared to other forms like MK4, meaning it stays active longer and provides more consistent protection for your arteries. When it comes to food sources, K2 is found in fermented foods like natto, which is fermented soybeans, and certain cheeses. Cheese is the richest source of long-chain K2, also known as MKs, the most effective form of vitamin K in the Western diet. When buying cheese for K2 content, look for aged varieties like Gouda, Edam, Maasdam, Swiss, Stilton, and farm-made raw milk cheese. The longer they age, the bacteria produce more vitamin K2 during fermentation. Meat can give you some vitamin K2, but it mainly contains MK4, which probably comes from synthetic additives in animal feed. Only fermented vegetables contain K2, with natto, or fermented soy, standing out for its MK7 content, packing way more than sauerkraut, about 200 times more. Just a 3-ounce serving gives you 708% of your daily vitamin K needs, but it's an acquired taste. For storage, keep your K2-rich foods properly refrigerated. Fermented foods should be stored according to package instructions, and cheese should be wrapped in wax paper or cheese paper rather than plastic wrap to allow it to breathe while preventing it from drying out. For the best results, take vitamin K2 along with vitamin D. Vitamin D helps activate proteins that make K2 more effective, working together to support strong bones and healthy arteries. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. 4. Vitamin B3, niacin. Niacin, or vitamin B3, is like a natural circulation enhancer, which has been used for over 50 years to treat atherosclerosis, where blood vessels get stiff and clogged due to plaque buildup. One of its most notable effects is its potent ability to cause blood vessels to dilate or widen, improving blood flow to your extremities. It works by releasing nitric oxide, increasing blood flow. Think of it as helping to open up those highway lanes in your circulatory system, allowing for better traffic flow to your hands and feet. Human studies showed that vitamin B3 can help reduce blood congestion in the veins, and even improve vision and macular thickness in people with retinal vein occlusion, also known as RVO, or blocked vein in the retina. Simply put, this vitamin may help your body grow new tiny blood vessels and improve oxygen flow. Vitamin B3 is also known for improving cholesterol levels, which can benefit blood vessels. In fact, vitamin B3 has been used as a drug to treat high cholesterol. It raises HDL, also known as good cholesterol, and lowers LDL, also known as bad cholesterol, and triglycerides. This can reduce plaque buildup in arteries, potentially lowering the risk of atherosclerosis. Your vitamin B3 needs depend on how much you eat. For every 1,000 calories, you'll need about 4.4 to 6.6 milligrams. If you're over 50, the basic recommended daily allowance, or RDA for short, is 16 milligrams for men and 14 milligrams for women. Note that most cereals and grains don't have much vitamin B3. That's why diets that rely heavily on corn and corn flour, especially if they're also low in tryptophan, can lead to pellagra, a condition caused by severe niacin deficiency. Fortunately, pellagra is rare because it's easy to get enough vitamin B3 from food. Just 3 ounces of beef liver gives you 93% of your daily value. Whole chicken and turkey breast provide 64%. Salmon, tuna, and pork are also great sources, containing 40 to 50% of your daily value in a 3-ounce serving, making it simple to keep your B3 levels up. For the average person, getting vitamin B3 from food or a standard supplement, up to 20 to 50 milligrams daily. It's generally safe and supportive for blood vessels. The problems mostly pop up with megadoses, which should only be done under medical supervision. Be sure to take it with food to avoid an upset stomach, and if you're using a time-release version, don't crush or open it. Keep it away from heat and moisture, as these can cause it to break down more quickly. Note that as vitamin B3 can cause vasodilation, widening of blood vessels, especially in the upper body, this can also lead to that infamous niacin flush, which is redness, warmth, itching. A 100 milligrams dose on an empty stomach can cause skin flushing or burning. While this isn't harmful for most people, it can be uncomfortable. In some cases, high doses, like those used therapeutically 1 to 3 grams daily, might stress the liver. For people with certain conditions like liver disease, peptic ulcers, or are pregnant, the vessel widening effect might not be ideal. Niacin can also interfere with certain medications, including those for blood clotting, cholesterol, and gout. Here's where we need to emphasize caution. While niacin can lower cholesterol, too much of it may actually increase the risk of heart disease. A 2024 study analyzed blood samples from over 3,000 people in the US and Europe. Over 3 years, researchers found that high levels of niacin breakdown byproducts, such as 2-PY and 4-PY, were linked to a 1.6 to 2 times higher risk of heart attacks and strokes. This suggests that excess niacin may trigger inflammation and plaque buildup in the arteries, making its effects a bit of a paradox. So, it's important to consult your healthcare provider before taking niacin supplements. 5. Vitamin E. Vitamin E is another antioxidant that shields blood vessel walls from oxidative damage. It protects blood vessel walls by neutralizing free radicals that can oxidize LDL cholesterol or damage the endothelium, which is the inner lining. What makes it particularly special for circulation is its ability to help prevent blood clots from forming. Simply put, it prevents LDL cholesterol from oxidizing, which is a key step in plaque formation and plaque buildup, also known as atherosclerosis. It also has mild anti-inflammatory effects, keeping vessels less irritated and more pliable. Plus, vitamin E helps make red blood cells and keeps blood vessels open to prevent clots. This vitamin also supports the body's use of vitamin K, another guardian for your blood vessels as we mentioned before. For adults over 50, the recommended daily allowance is 15 milligrams, equivalent to 22.4 international unit if natural or 33.3 international unit if synthetic, of alpha-tocopherol, the most active form of vitamin E. Some research suggests that for other benefits or to treat a deficiency, you might need 200 international unit daily. Vitamin E needs fat to absorb, so it's smart to take it with a meal that has some healthy fats, for example, avocado or nuts. Plus, try taking vitamin E and vitamin C together. Vitamin C helps recycle vitamin E in the body, making both more effective at protecting your blood vessels. Simply put, vitamin E protects cell membranes by neutralizing free radicals. When it does this, it becomes oxidized, forming a radical. Vitamin C, another antioxidant, can regenerate vitamin E by donating an electron to this radical, converting it back to its active form, alpha-tocopherol. Vitamin E is commonly found in edible oils, especially wheat germ oil, nuts, and seeds. Just an ounce of sunflower seeds or almonds can provide 50% of your daily value. Sunflower oil, hazelnuts, and safflower oil are also excellent sources. While whole nuts can be expensive, you can often find them cheaper in bulk sections. Just be sure to smell them first. They should have a fresh, nutty aroma with no hint of rancidity. Remember that vitamin E is fat-soluble and can go rancid if not stored properly. Keep your nuts and seeds in an airtight container in the refrigerator, especially during warm months. For oils, dark glass bottles are best, and they should be stored away from heat and light. Deficiency is rare and usually caused by problems with fat absorption, not diet. People with fat malabsorption conditions, such as pancreatic problems, Crohn's disease, or celiac disease, are particularly vulnerable since vitamin E needs fat to be properly absorbed. Watch out for signs like muscle weakness, vision problems like narrowed vision or difficulty looking upward, numbness and tingling, and poor balance. These could indicate low vitamin E levels. Chronic stress and prolonged use of certain medications, especially statins for cholesterol control, can interfere with vitamin E absorption. A low-fat diet, while sometimes recommended for health reasons, can ironically lead to vitamin E deficiency if not properly planned. Since vitamin E supplements are widely available, concerns exist about their potential risks. At high doses, vitamin E can act as a pro-oxidant, promoting lipid damage in blood vessels, especially when combined with vitamin C. It is important to note that getting vitamin E from food is still safe. The concern comes with high-dose supplements, such as 1,000 milligrams, equivalent to 1,490 international unit if natural, or 1,100 international unit if synthetic, which, in rare cases, may increase the risk of issues like bleeding in the brain, also known as hemorrhagic stroke or birth defects. But for most people, a balanced diet provides just the right amount. Conclusion. Well, there you have it. Our comprehensive guide to the 5 essential vitamins that can help improve blood flow to your hands and feet after 50. But before you stock up on supplements, let us share some important takeaways that will help you make the most of this information. First, remember that these vitamins work best as a team. Vitamin C, the structural builder, fortifies blood vessel walls with collagen. D3, the flow enhancer, relaxes them for smooth circulation. K2, the structural guardian, blocks calcium buildup. B3, the flashy flow enhancer, widens vessels fast while aiding cholesterol. And E, the slow burn protector, shields against oxidative damage. Together, they're a powerhouse. C and K2 anchor structure, D3 and B3 boost flow, and E ensures longevity, keeping your blood vessels, especially to the extremities, strong, flexible, and clear. Here's something crucial to keep in mind. While supplements can be helpful, getting these nutrients from whole foods should be your first strategy. Not only do whole foods provide these vitamins in their most bioavailable forms, but they also come packaged with other beneficial compounds that support absorption and overall health. That said, if you're over 50, you might need a combination of food sources and supplements to meet your needs, as some vitamins become harder to absorb or produce as we age. Always work with your doctor to determine the right combination for your specific situation. And speaking of working with your doctors, please remember that while these vitamins are natural and generally safe, they can interact with certain medications or medical conditions. This is particularly important if you're taking blood thinners or have a history of blood clots. Don't forget that vitamins are just one piece of the circulation puzzle. Combine these nutritional strategies with regular movement, proper hydration, and stress management for the best results. Even something as simple as taking short walks after meals or doing gentle hand and foot exercises can enhance the benefits of these nutrients. After consistently supporting your circulation with our suggested vitamins, optimally with the support from your doctor or dietitian, you'll likely start noticing some positive changes. One of the first signs is often warmer hands and feet. You might also notice that minor cuts and scrapes heal more quickly. Your skin tone might become more even, especially in your extremities, and that bluish tint some people get in their fingers or toes might diminish. Nail growth and strength might improve. However, remember that these improvements typically happen gradually over several weeks or months. If you're not seeing improvements, or if you experience any unusual symptoms, especially if they're sudden or severe, it's important to consult with your healthcare provider. They can help determine if there are other factors affecting your circulation that need to be addressed. Now, we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. Your circulation and kidney health are more connected than you might think. In fact, poor circulation can be one of the first signs that your kidneys need attention. The sooner you spot kidney issues, the more you can do to keep things under control. If you're unsure about your kidney health and haven't been in a good shape recently, check out the video on the screen. Here, we cover all the possible symptoms, helping you spot kidney failure and take action effectively if needed. See you there. Stay informed, stay healthy.